Good afternoon. Do I have a volunteer here or in the audience that would like to follow Sandy Halperin? It's not an easy task. My name is Patrick Hogan. I'm a retired senior administrator at a major public university in Tallahassee. I am a caregiver, one of some 14 million plus men filling this role in our nation. I first learned to walk through the darkness of dementia by caring for Sarah, my wife of 57 years. She died 3 years ago from dementia with Lewy bodies. As you know, a very aggressive dementia represents some 15% of dementia diagnoses. Almost immediately, with an assist from the National Lewy Body Association, we delivered informational materials to doctors and patients, more than 100 healthcare providers and clinics. It is making some difference in the awareness in Tallahassee, my Florida home. It's hard to say if the 262 medical visits that we had in Sarah's last 3 years took a toll on my physical and emotional health. The book, Take Your Oxygen First, co-authored by Lisa Gibbons and a friend, Geriatrician of the Year, Rosemary Laird, gave me valuable tips to preserve my health and well-being as we traveled through this experience. It taught me resilience. It taught me realism. So I seldom experienced anger, anxiety, or other negative emotions. As I cared for Sarah, I considered it a grand privilege and a marvelous opportunity to demonstrate to my family, my friends, yes, and the medical staff, both awareness and acceptance of her non-curable Lewy body disease. I embraced my role, knowing it was transitional and temporary. Then, when I thought my caregiving was done, along came Dr. Sandy Halperin, a vigorous, indefatigable, I'll explain what that means later to you, indefatigable advocate for dementia care and cure, from whom you just heard. I'm honored to be one of Sandy's best friends and part of his primary support team, as he mentioned this morning, and as he continues to live with dementia while caring for his courageous wife, Gail, in remission now with stage 4 cancer. She cares for him while battling her own daily challenges. The focus of a current CNN documentary, there with us today, as Sandy mentioned, is chronicling his story, his journey with Alzheimer's disease. They've been doing this for 2 years. Some of you may have seen chapter 1. There'll be others forthcoming. And just as a side note, the videographer who was with us yesterday, shadowing us around Washington, left here yesterday, left us, went to Baltimore, and was injured. He was in the hospitalized for a few minutes. I don't know whether that's been on television or not. But he's now home and doing much better. But he has a broken nose and some facial lacerations. So, Brian, be careful when you leave here today. Sandy is an active, many of you know, alumnus of the Alzheimer's Association Early Stage Advisory Group, and I watched him to receive a standing ovation after a closing keynote speech in St. Paul. I saw him fire up an audience in the National Press Club here in D.C. as he made the case for action for patients living with dementia. Tireless in his networking and outreach efforts, he has friends all over the world. He feels compelled to be part of the discovery of diagnoses, treatments, and cures, as well as destigmatizing dementia. Day and night, he champions enhanced care for those living with dementia and their caregivers. That's why he's here today, as he mentioned. How's he doing? Well, he's 5 years into living with Alzheimer's. He knows that his conversational hiccups are more frequent these days. His ability to think and recall is fading. While still engaged in living vitally, despite his deficits, he's aware that he's balancing midway down a descending escalator of memory. That's why he's asking you to help him identify the most urgent steps he should pursue as an advocate in the months ahead. What softened the blow of Halperin's diagnosis was the way he responded to it. He chose to combat it. He didn't crawl into Washington Irving's cave and go to sleep with Rip Van Winkle. His wide-awake mission continues to be a town crier every day with all aspects of dementia, including Alzheimer's care and research. It's not for himself. He clearly understands where he stands in this worldwide public health crisis and the complex issues of research and adequate resources. He dreams, however, of possibilities and breakthroughs for our children and future generations. He's been criticized for thinking too big, of dreaming about solutions that many believe are unattainable, like those purple butterflies flying over the White House that he mentioned this morning. That's a big thought, right? During his lifetime, he does want to witness the care and cure of dementia to become our nation's leading healthcare priority, or one of the leading priorities. By now, you know that Sandy subscribes wholeheartedly to the lyrics of Dr. Martin Luther King's favorite song, "If I can help somebody as I pass along, then my living shall not be in vain." In Florida, we're at the epicenter of the 21st century challenge. I think one of the problems is all the people from New York are moving to Florida now, and made us the third largest state now. Maybe some from New Jersey, too. Sandy and others are active in the Florida Alzheimer's disease state initiatives, putting a lot of balls in motion to change the culture, create more awareness, serve hurting families. Our Florida goal, like many of you, is a dementia-capable and friendly state. We formed in 2014 an Alzheimer's Action Group at Westminster Oaks, large continuing care committee where we live independently, with no budget. We're promoting awareness of the global crisis. Rohini, do you have any water? Something there. We're promoting awareness of the global crisis, emphasizing the importance of collaboration between caring organizations in our area, and encouraging both local, state, and national elected officials to give far more urgent priority to research, awareness, and education to enhance care for those living with dementia. We're campaigning hard to ensure that these people live well and that their families and friends are properly supported. Thank you. Sort of like Senator Rubio did one time. I didn't have to reach for it. Well, we've coordinated two major public forums, Alzheimer's awareness and caregiving. We're committed to global dementia care, so people now living with dementia, like Sandy, can lead happier, more fulfilled lives for as long as they can. As we view your NAPA efforts from Florida, we are actually buoyed by your resolve and your planning for progress. We're impressed with the potential for further advancements, with the robust, comprehensive recommendations from the Advisory Council's public members. We urge early implementation of these recommendations and the reinforcement of these fresh initiatives with bold action that Sandy's calling for. And you have an opportunity-rich environment. As Ms. Connolly mentioned, I counted 7 opportunities she gave us this morning in her remarks. So we have a wonderful opportunity here. In closing, let me say that one of Lincoln's quotes fit here, I think, fits your present enormous challenge. He said, "The dogmas of the quiet past are inadequate to the stormy present. The occasion is piled high with difficulty, and we must rise with the occasion. As our case is new, so we must think anew and act anew. We have confidence that you will act anew with some urgency for the compassionate benefit of millions living with dementia and for their caregivers." Thank you for hearing my comments.